Hey y'all, this is Suzette. Let me adjust my camera. Welcome to my channel where I'm redefining my 60s on my own terms. I hope you all are doing well today. It's been a very busy day for me, I tell you. You can probably tell by my eyes that I'm looking a little tired, but just know that my spirit is strong. And you may hear some background noise because my husband is here. This is just one of the consequences of Zooming from home. But I think, we'll be all right, won't we? We'll be just fine. Today, I want to talk about Agenda 47. If you haven't already, I ask you to check out my other videos where I have already focused on education, immigration, and crime. So I strongly urge you to look at those as well, because I'm just going through different sections of it. And for those of you that don't know, I am definitely a Kamala Harris supporter, Kamala Harris and Tim Walz. And so my focus on Agenda 47 is to really look at what Trump is calling his focus. While he has distanced himself, so to speak, from Project 2025, there are too many people that he is connected to that have come together for that conservative plan for him to know nothing about it. I have to say, I agree with Tim Walz when he says he has to know more about it because there's certain things that have already started happening that come right out of that playbook. And so I think Roe v. Wade, the turning that back, the discontinuing affirmative action, if you were to drill down into those 900 plus pages, you would see certain things worded in such a way that you say, this is in complete alignment with this plan. But because a lot of people are talking about Project 2025 and very few are talking about Agenda 47, I wanted to focus on this and give my thoughts. I will be looking directly at Donald Trump's document. It's a 16-page PDF right off of his website where he lays out his agenda. And I will be sharing some other observations that I've had having lived through his first presidency forward and looking at fact check and PolitiFact to get a better gauge on some of the things he's claimed, whether they're true, mostly true, false, mostly false, or pants on fire. You know that liar, liar, pants on fire? Yeah, whether his pants are on fire from making that claim. So feel free to get your pen and paper if that's the way you roll, or you can go to his site, download Agenda 47, and you can follow along. As I've said in previous videos, um, while I do not find other opinions to bother me at all, I welcome people having different opinions and different perspectives. But one thing that I will not allow on in my comment section is any lowballing, any put downs, any bullying, mean spirited kind of comments. Um, Rather than for you having one liners, like this group for Trump or that group for Trump or Trump all the way, I would prefer that you give some substance to why you are favoring him. And if you are making any particular claims, if you can include your sources, that would be very much appreciated. So, without further delay, let's jump into it. Now, I must say that in looking at Trump's Agenda 47, I did not find a whole lot of substance when it came to what his plans are with respect to healthcare, which is our focus for today. It's dealing with healthcare because that's been a significant focus for both the Harris campaign and the Trump campaign. And so I want to definitely look at that. I know that's a concern of mine. I know that's a concern for a lot of other Americans. And so I'm going to be scrolling through the PDF. Um, what I find of interest is when in his preamble, where he kind of summarizes what his position is. He keeps referring to common sense, um, but that's kind of relative. Common sense is, no, I guess I should say common sense is subjective. So hopefully I will be able to break down some of the things that he thinks is common sense. I have looked to see his first 20 goals that he wants to accomplish very quickly, should he win the White House. And in looking at the different ones, I was looking to see if healthcare was front and center in any of them. And the only thing that I see in glancing through the first 20 that he has summarized or listed is number 14, fight for and protect Social Security and Medicare with no cuts, including no changes to the retirement age. Other than that, I don't really see anything more when it comes to healthcare in his preamble. So we're going to go into the table of contents, which I'm having to scroll because while he's dealing with quite a few things, you kind of have to look and see what's sprinkled within that speaks to healthcare. So let's see here what we have. Chapter 4, number 3 under Chapter 4, it says affordable health care. Health care and prescription drug costs are out of control. Republicans will increase transparency, promote choice and competition, and expand access to new affordable health care and prescription drug options. We will protect Medicare and ensure seniors receive the care they need without being burdened by excessive costs. Okay, he says that about health care. Let's see what else he says here. Still looking. Now, chapter 6 is titled Protect Seniors. So I'm going to read this. It's 5 different points that he makes here. He says, our commitment. President Trump has made absolutely clear that he will not cut one penny from Medicare or Social Security. American citizens work hard their whole lives, contributing to Social Security and Medicare. These programs are promises to our seniors, ensuring they can live their golden years with dignity. Republicans will protect these vital programs and ensure economic stability. We will work with our great seniors. I don't know what that means, but I think when you live to be a certain age, we all are great, right? In order to allow them to be active and healthy. We commit to safeguarding the future for our seniors and all American families. Number 1, protect Social Security. Okay. Social Security is a lifeline for millions of retirees. Yet corrupt politicians have robbed Social Security to fund their pet projects. Okay, might have to fact check that. Republicans will restore economic stability to ensure the long-term sustainability of Social Security. Um, I don't know where politicians have robbed Social Security. If Social Security is indeed what we've been paying, is our money, right, that we have had taken out of our paychecks for over our whole work life, then I don't understand how it's been robbed. So that's kind of suspect to make that kind of statement. He'd have to show evidence of how it's been robbed because I don't see how it's been robbed. Okay. Strengthen Medicare. Republicans will protect Medicare's finances from being financially crushed by the Democrat plan to add tens of millions of new illegal immigrants to the rolls of Medicare. We vow to strengthen Medicare for future generations. In my video that I did on immigration, I deal with any particular benefits, federal, not so much benefits, but federal funding and the specific cases related to immigration. So I think before throwing the baby out with the bathwater, I encourage you all to look at that video because one of the questions becomes, do you create a bigger problem by not doing certain things, or would you create less of a problem by discontinuing it? You know, it just depends on what would cause the greatest consequence. So I encourage you all to look at that for any questions that you have about that. Number 3, support active and healthy living. Republicans will support increased focus on chronic disease prevention and management, long-term care, and benefit flexibility. We will expand access to primary care and support policies that help seniors remain in their homes and maintain financial security. Now, all this is under Protect Seniors. Okay, so that's not dealing with health care, but healthy living does. Protect care at home for the elderly. Republicans will shift resources back to at-home senior care, overturn disincentives that lead to care worker shortages, and support unpaid family caregivers through tax credits and reduced red tape. Yeah. Now this right here again is kind of a reach. Number 5, protect economic foundations for supporting seniors. Republicans will tackle inflation. Okay, that's good. Unleash American energy. That's in caps, so I don't know if that's going to become a almost like is that going to be the name of some kind of agency from which energy is legislated? I don't know why it's called American energy. That part, I'm not sure what that means. Restore economic growth and secure our borders to preserve Social Security and Medicare funding for the next generation and beyond. Again, the reason why I'm kind of like, this is a bit of a reach is because, again, we have paid into Social Security and Medicare, or Social Security and Med, okay, which is Medicare, right? We've paid into that through our paychecks. If you have made a salary or gotten paid, excuse me, misuse of the word because some salary people, well, salary people get the same check no matter what, but regardless, if the money is being taken out to go into these entities, then I don't understand what how it's being, why it's needing to be preserved for the next generation and beyond. That part I don't, and secure our borders to preserve. That's the part. He said to secure our borders to preserve it. Like, how in the world would undocumented people qualify for Social Security and Medicare? If somebody knows what is meant by this, please feel free to put it in the comments, because I don't see how this is really relevant. Maybe a dig, but I don't see how it's really relevant to healthcare. Okay, so there you go. I'm looking to see what else he's got here. I'm looking at chapter 8. I don't see anything else that's dealing with healthcare. Okay, now chapter 8, number 4, take care of our veterans. It says Republicans will end luxury housing and taxpayer benefits for illegal immigrants and use those savings to shelter and treat homeless veterans. We will restore Trump administration reforms to expand veterans' health care choices, protect whistleblowers, and hold accountable poorly performing employees not giving our veterans the care they deserve. So expanding veterans' health care choices. Okay, I'm not a veteran, so I will just take that at face value. I don't understand about luxury housing to illegal immigrants. I don't understand that. That part I don't understand. Again, something of a reach. Okay, so let's see what else. Okay, I'm looking to see if there's anything else related to healthcare. I don't see anything else in his agenda that deals with healthcare specifically. I'm at the end of it now. So now let's look at some claims here. Because I know 3 areas of healthcare that are of importance are Obamacare, which is the Affordable Care Act. They're the same thing. Some people didn't know that, so I thought I'd better say that. The abortion ban, so reproductive health, Medicare. So I've already read what his agenda says about Medicare. So that part I'm not going to really focus as much on, because I think he's put a lot of effort into making sure there is no doubt that he does not plan on cutting any of those, which I don't know if he could really do that since we've already paid it out of our paychecks. But, you know, okay, that's great to hear. So let's look at do some fact checking when it comes to abortion. Okay. Um, let's see what we have here. In factcheck.org, but related to the issue of abortion, um, August 1st, 2024, it says Trump distorts the facts in attacks on Harris. At a campaign rally in St. Cloud, Minnesota, former President Donald Trump rattled off several criticisms of Vice President Kamala Harris, his presumptive opponent in the presidential race. But some of Trump's attacks ran afoul of the facts. Okay, let's see what this is. Because I know Yeah. Let's see here. Um, okay, I do want to kind of double back a little bit on Medicare because I think this is important as I'm looking at this information at the factcheck.org. And again, I've said it in previous videos. I'll put links to my sources in the description, so feel free to do your own research. I encourage it. I feel like we should not follow candidates blindly or become groupies or take on a cult-like um, adoration to the point that we cannot see and critically think and weigh out the pros and cons. So, yeah, feel free. I encourage that you do your research and come to your own conclusion as to what candidate best represents what you fundamentally believe and who you fundamentally believe. Okay? Toward belief, and as I've said before, I think character and integrity very much matters, not just how what laws a person passes, but how they legislate. Because we are democracy, we the people. So having a dictator, having somebody force something down our throats, that is not the American way. Okay, so yeah. So here we go. Trump falsely claimed that Harris voted to, quote, cut Medicare by 237 billion, end quote, and, quote, betrayed American seniors, end quote. The legislation allows Medicare to negotiate drug prices and reduces costs for some seniors. Okay. Um, he pointed to Harris's support in early 2019 for Medicare for All, saying she, quote, endorsed outlawing private health insurance entirely, end quote. The truth is, Harris also proposed a plan later that year that included private insurance. But regardless, she isn't supporting Medicare for All now. Okay. So those were two falsehoods. Okay, let's see. Let's see what else we've got. Okay, I think this goes to health and well-being. The former president, Donald Trump, said Harris, quote, called for slashing consumption of red meat to fight climate change, end quote. Harris once said she supported encouraging and incentivizing Americans to eat better, but she did not say she would restrict how much red meat is consumed. Okay. Let's see. Okay. Trump falsely said Harris supported abortion, quote, even after birth, end quote, and he wrongly said, quote, all legal scholars, end quote, wanted the issue of abortion rights to be returned to the states. So he lied about those things. Okay. Let's look at Medicare benefits, not cuts. Um, this is a fact check. Oh, okay. Oh, something else before I move on. It says, this is fact check now, y'all. Fact check says Trump baselessly said that Harris would let, quote, 40 to 50 million more people in our country, end quote, referring to illegal immigration, and added that it would, quote, kill Social Security and Medicare, end quote. Those concocted figures aside, workers who aren't authorized to be in the country can't receive the benefits of those retirement programs. Remember when I was going through it and I said this sounds suspicious. How is that possible? Thank you, Fact Check, for corroborating uh, my hesitation in the claims on Agenda 47. It says Trump spoke in Minnesota on July 27th, the day before in Florida. Trump made some of the same claims on Medicare, inflation, and abortion. Okay, let's look at a few. You can drill down at your leisure. I just want to give you some facts, which speaks to trustworthiness, character, and integrity in following through on things he's claiming that he will do, um, and some of the exaggerations, even in the claims. It's like making something a problem that's not even a problem, right? So anyway, Trump falsely claimed that Harris, quote, cast the tie-breaking vote to cut Medicare by 237 billion, end quote, telling the crowd in Minnesota that, quote, she betrayed American seniors, end quote. He's referring to the 2022 Inflation Reduction Act, which passed the Senate with Harris's tie-breaking vote. But the law doesn't cut benefits for seniors. In fact, it could lower what some seniors pay for prescription drugs. Okay. Let's see. Okay. Let's look at this a little bit for deeper, okay? Then I'll move over to PolitiFact and see what's over there. It says the Medicare provisions of the law are expected to lower federal deficits by 237 billion over 10 years, according to the Congressional Budget Office, by, among other things, allowing Medicare to negotiate the prices it pays for some drugs and requiring rebates from drug companies if their prices increase faster than inflation. The provisions will lower out-of-pocket costs for some beneficiaries. So this is talking about the 2022 Inflation Reduction Act, okay? Um, which passed the Senate with Harris's tie-breaking vote, okay? Um, the provisions will lower out-of-pocket costs for some beneficiaries, and lowering Medicare spending overall strengthens Medicare's finances. The Nonpartisan Health Policy Research Group, KFF, said in a 2023 analysis that the number of beneficiaries who will pay lower drug costs and how much they save, quote, will depend on how many and which drugs are subject to the negotiation process and the price reductions achieved through the negotiations process relative to what prices would otherwise be, end quote. The law also caps seniors' out-of-pocket costs at $2,000 a year for Medicare's prescription drug plan next year, and it has already capped monthly insulin copays at $35. Those provisions cost the federal government money, as we've explained. Okay, so what Trump has claimed is not true. Okay, then let's look at private health insurance. Okay. Okay, Trump highlighted Harris's support in 2019 for Senator Bernie Sanders' Medicare for All legislation, which aimed to expand Medicare to everyone, creating a universal health care system. Trump said Harris, quote, endorsed outlawing private health insurance entirely, end quote. But at the time, Harris wasn't as steadfast as Sanders that private health insurance would have to be eliminated, and Harris is no longer supporting such a plan. So he's going way, 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 way back. Okay. Um, her campaign told us Harris, quote, will not push Medicare for all as president, end quote. Okay. Okay. At a January 2019 town hall on CNN, Harris indicated that Sanders' plan, which she supported, would lead to the elimination of private insurance. But the next day, her press secretary noted that she also supported other healthcare legislation that wouldn't go that far. Later in the campaign, Harris proposed her own version of Medicare for All that would include a role for private insurance. But now, Harris isn't advocating Medicare for all. So those are the facts, okay? So, okay, let's look at abortion. And right now, fact check is a gift that just keeps on giving. So let's just kind of stay right here for a minute, okay? Okay, when it comes to abortion, which is another one of the um, issues, one of the main issues that both candidates have strong feelings about. Um, it says, and of course, we know that Trump has taken credit for rolling back Roe v. Wade, which had a significant impact on how abortion is legislated. And sadly, that ruling has really caused a ripple effect. And that's one of the things that is a main issue that each campaign has their thoughts about. Now, me being a woman, I favor reproductive freedom. While I definitely am not a person who could see myself having an abortion. I grew up Christian in the Black church, so I did not grow up with that being even an option. But my mom and my dad, who were very, very, very true to their faith. However, that being said, I don't think government should force the opinion of a select group, the MAGA plan or the MAGA conservative agenda. I don't think they have the right to push that kind of legislation on all of America's citizens. I don't think that's fair. It really is a dialing back of the rights of women to make decisions about their reproductive health with their doctor and their family. I feel like that's where it should stay. And I feel like government is putting their nose where it does not belong. You can definitely be pro the family without forcing your citizens to comply to a set of rules that's very constraining and is just not fair. So, yeah. So let's look at the fact check when it comes to abortion. Okay. Trump repeated false claims he's made before about abortion. He said that Harris, quote, wants abortion right up until birth and even after birth, end quote. And I've heard him say some of these things at his rallies and in his interviews. There are no post-birth abortions. That would be homicide, and it's illegal. So that's a lie. Again, and they're bringing it up again, where he said that everybody and all legal scholars wanted the issue of abortion rights to be returned to the states. That's not true. Plenty of legal scholars and a majority of the American public didn't want the Supreme Court to overturn Roe v. Wade, which it did in June 2022, sending the issue to the states. Okay. Trump said that Harris, okay, wants abortion. Okay, da, 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 da. And they go into even deeper explanation. I don't think I need to um, go through that. But I will say what Harris has said. She says, and when Congress passes a law to restore reproductive freedoms, as President of the United States, I will sign it into law. She said that July 30th at the July 30th rally in Atlanta. Okay. Republicans have pointed to a September 2023 interview on CBS News Face the Nation saying that Harris didn't explain what gestational limit on abortion she would support. Harris said she wanted to, quote, restore the protections of Roe v. Wade, end quote, adding, quote, we're not trying to do anything that did not exist before June of last year, end quote. So to me, that kind of explains it, right? Yeah. And here is something that I want to add. It says abortions late in a pregnancy are rare. According to data from the Centers for Disease Control and Prevention, a 93.5% of abortions in 2021 were performed at or before 13 weeks of gestation, and less than 1% were performed at or after 21 weeks. Oh my goodness. He just keeps saying a bunch of things that is just not true, y'all. And I'll let you all do some more reading because it's a whole bunch that he's saying, and they've summed it up by saying, when we wrote about this in April, legal scholars told us that the claim that he was making was utter nonsense and patently absurd. You know? Okay. So let's look and see what PolitiFacts has to say. Probably some of the same thing. Um, Probably some of the same thing. Let's look at specific to Obamacare. Okay. Um, this is something that PolitiFact says. Um, they quote Donald Trump as saying, real change begins with immediately repealing and replacing the disaster known as Obamacare. And he promised when he ran the first time that he was going to repeal and replace Obamacare. Well, the Trumpometer, as PolitiFact calls it, says that promise was broken. He was not able to do that. There was no repeal, there was no replace. The promise to repeal and replace the Affordable Care Act, the sweeping health insurance law, also known as Obamacare, regularly drew roars of approval at Trump campaign rallies. There was a 2-year window when Republicans held both the House and the Senate that President Donald Trump might have had enough votes to deliver. The effort fell short in 2017 when 3 Senate GOP defectors stalled the Republicans' best hope for repeal. The party did successfully neutralize the penalty on people who were able to afford health insurance but chose not to buy it. The requirement to buy health insurance, known as the individual mandate, was one of the least popular provisions in the Affordable Care Act. In their 2017 tax bill, Republicans set the penalty at 0. So he did accomplish that. But by itself, the move did not wipe out Obamacare, and I am so grateful that it did not. True story on my part. When I was working for myself as an entrepreneur and I needed health care, I was able to go on what we call the exchange. where I was able to look at the different offerings from various insurance companies under the Obamacare Affordable Care Act plan. I was able to afford better health care than what I was getting as an employee because of the Affordable Health Care Act. My insurance would have normally been $750. I got it for around $325 per month. And it was a better plan. All around, it was a better plan. The government subsidized, and their subsidies allowed me to have great health care insurance under the plan. So I sing the praises of Obamacare, and I'm so glad that he was not able to repeal and to replace Obamacare. And I'm sure even there are some of you all who are planning on voting for Trump that did not realize at the time that the Affordable Care Act was Obamacare. I actually looked at an interview on TV during the time everybody was all up in the air about it. And they were saying, we don't want Obamacare. We don't want it. We don't want it. We don't want it. And then somebody said, well, do you want the Affordable Care Act? Yeah, we want that. And they were like, the Affordable Care Act is Obamacare, right? So anyway, there is that. And let me add this because I think people who are proponents of, um, you know, they're pro um, the 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 unborn child. We want to stand up for the rights of the unborn child. The thing that I find very, very curious is how can you protect the rights of an unborn child without protecting the mother, right? And there are certain situations that come up, men. Let me kind of give you a lesson from us women that know more about our bodies, know more about our monthlies, know more about how our bodies work than you do. Yes, it is a dig because I find it absolutely ridiculous that somebody who does not have a uterus, does not have a period, and cannot carry a child is trying to tell us what to do with our bodies. But yet, let me get back to what I was going to say. There are situations, sadly, that are putting people at risk because the medical profession, the doctors, don't want to lose their abilities to practice or face jail time. They don't know what they can do and what they can't do. And so, because some of them are afraid, there are certain things that they would normally, certain treatments and certain approaches they would normally do, that they're feeling like their hands are tied. And as a result, women are being put in a position of suffering, suffering, suffering pain, um, suffering where certain things cannot be done to help them unless they're near the point of death. I mean, listen, it's an extreme. I was wondering, what about situations that a father would be put in where the doctor comes out and says, listen, you need to make a decision whether to save your wife or to save your unborn child. What happens in those situations? What happens? Do you feel like saving the child is more important than the mother and letting her die, save the child, and then leaving that husband, that father, to take care of that child by himself and his other children? losing their mother? I mean, I keep seeing in Agenda 47 common sense, but to me, where is the common sense with people having such a zealot view when it comes to abortion that they have no regard and no respect for the woman that's having to carry that child? People don't realize that carrying a child is not an easy thing. It's not an easy thing. And there are lots of risks when you're carrying a child. There's the risk of toxemia. There's so many different risks when we're carrying a child. And so I truly believe in my heart that the decisions made should be left between that woman, her family, and her doctor. And it's not the right of government. It is not the right. There are other situations. There are other things that can happen while a woman is carrying a child that I don't think have really been thought through. And as a result, you're hearing report after report of women who are going through absolute hell, going to doctors, and the doctors feeling like their hands are tied to really provide the kind of excellent and expert care that that woman needs. There was a question about whether contraceptives will ultimately come under fire. And I was thinking, if they did, what would happen to someone like me who, when I first started having a monthly period, really close, and I started having a period at the age of 13, and I would have very severe pain early on. Early on. It wasn't until I was in college, I had to be about 19. So you're looking at 6 years of having a painful period every month, where I'd sometimes go to the emergency room, go to the doctor's offices, writhing in pain, and doctors would tell me it was in my head. They would tell me, exercise will help, and all it did was make it worse. They would tell me all these different things. They would give me painful examinations, all these things happening to me, a young girl at the time. And I remember going through an extremely bad, painful period where I was rushed to the hospital. And it wasn't until there was a doctor by the name of Dr. Ron Neal. I was a student, a college student at the time, and he told me about endometriosis. I had never heard of it before. He told me about it. He did exploratory surgery that confirmed, in fact, that I had endometriosis all up and down my right side of my uterus. I had it, and it was causing scar tissue to form. Okay. At that time, the only treatment for endometriosis was birth control. I was prescribed the most potent dosage of birth control to help me with endometriosis. What would have happened to me had that not been available? What would have happened to me? And yes, it wasn't the ideal, but it was the only treatment at the time. What would have happened? And what options do young girls have who are going through painful periods? if contraception becomes a part of this, if that's left up to states too, and some of the more rigorous protectors of the unborn child and all of this and focusing on family values and that kind of thing, or that almost want to punish young girls for getting pregnant or whatever, what happens in those states? What happens? So I just wanted to add some personal experiences that I've had as a woman, as a young woman coming of age, that really people who are making laws aren't considering. I cannot advocate for the rights of the unborn child over the rights of the mother that has to carry that child. I just cannot. I cannot do it. And I am a Christian, but I don't feel like it is the government's role to legislate it. If your faith base is one that is against abortion, then don't have one. That's simple. You have a right to exercise your freedom. Don't have one. But don't infringe upon my reproductive rights as a citizen. Don't roll back my rights as a woman. So that's my final take on this. Um, Again, you're welcome to share in the comments. Keep it classy. We can agree to disagree. We can share our thoughts and all that in the comments. But like I said, any lowballing, any condescent, any mean-spiritedness, any exaggerations, like everybody knows that. Those kind of, any mocking, it's just not going to be allowed. And I will reserve the right to delete any comments that I feel like are are perpetuating that kind of denigration, that kind of condescent. We are condescent. We are adults, and we can agree to disagree. And you can make your point, and I can make mine, and others can make theirs. But yeah, yeah. So I welcome your comments as long as you keep it classy, and I encourage you to do your own research. Okay? And I'll see you. Oh, and again, and if you like what I'm doing, please like, share, subscribe. And that's it for now. Again, I encourage you to look at some of my previous videos that I've made about Agenda 47. And I'll see you in the next episode. Okay? Bye bye.